Hi, everyone. Good morning, good evening, good afternoon, from wherever you're watching us from. Don't worry. Today I have changed my look a little bit. This is actually from Samburu, and as you can see, it is very cultural, and I appreciate a lot of culture from different communities. Yeah, so welcome again to my YouTube channel. Continue subscribing, and I hope you find the content that I bring to you interesting and helpful. So today I'm joined by my friend Mary. She's a mental health advocate, and we are going to discuss about mental health and link with cancer and vice versa. So I would like to give this opportunity to Mary so that she can tell us who she is, what she does, and then from there now we can get to the topic of the day. So over to you, Mary.
Oh, wow. Okay. Thank you, Esther. How are you?
I'm good.
Um, okay. So, as you said, my name is Mary Mbithe, and I'm a social worker as well as a mental health advocate. And right now, I'm mostly doing social work, still a bit of mental health on the side. And I'm working with street connected children right now, helping them, rescuing them, and reuniting them with their families. Yeah.
Amazing. That is amazing work you're doing. I think one of the things that I have come to realize about the work that we do, working with community, being able to interact with people and being able to help someone, it's so fulfilling. And I don't think that feeling you can ever get it anywhere else. So that is amazing. So let's get to the key objective of today. Thank you. First of all, thank you so much for finding time to do this. I know we've been in communication to try and make it work. So thank you so much. I appreciate. So
It's okay.
let me ask you, is there really a relationship between cancer and mental health or mental health and cancer? Is there any connection?
Yes, actually, I'll say there is. I can actually start by saying the link between cancer and mental health is that cancer is such a serious illness. And with it, it brings a sense of foreboding, like you don't understand your life. It's like your life is somehow interrupted. So it can cause some problems like depression, anxiety, stress, some disorders like bipolar. And then on the other hand, some mental issues, the same as depression and bipolar, anxiety issues, can also cause cancer. Because especially among young people, for those with such uh, disorders, sometimes it can translate to using recreational drugs or things like cigarettes, which cause throat cancer, lung cancer, and such. So there is a big link between cancer and mental health and vice versa. Yeah.
That's quite interesting. You talked about people with like mental disorders, like bipolar, but how about like a normal person? Uh, is there Are there contributors that can cause someone to develop anxiety or depression, stress, and eventually lead them to getting cancer? Or is it just who is vulnerable here?
Research is still going on, but I'd say that people with these disorders, especially the mental disorders, have a defect in their brain. So sometimes, depending on the person, it's not everyone that it happens to. So depending on the person's brain, it can lead to cancer. It's not yet definitive as of now, but it can because of that someone's brain chemistry. You can develop brain cancer from some of these things because of the way your brain is working. So there's some abnormal cell growth So meaning at some point something might happen, not a must, not necessarily, but might happen. So the studies are still ongoing, and we'll keep looking into it.
Yeah, that is quite interesting. So thank you so much for that. So let me ask you, so for someone who is caring for someone, for a loved one, for carers, for patients with cancer, how can they help their loved ones to not fall into depression or anxiety? And also, what should someone, a carer, do to ensure that their mental wellness, because as we know, cancer is very draining, both financially, both socially and mentally. So how can, let's first of all start with the patient, how can the patient ensure that they don't fall into mental illness?
Okay, so for the caregiver and the patient, the solutions might be connected because, as you say, it's draining on the caregiver seeing this patient in such a state, and it's draining for the patient to be in that state. So, one of the most important things actually is to seek help from a mental health professional, a psychologist, a psychiatrist, a counselor, whoever person you need to talk to about this. They can help you navigate through this journey that is really one of the hardest journeys someone has to go through. The second thing is to make sure you don't get isolated. Because as you know, when you're really idle, even us, when you sit by yourself, some thoughts come into your head and then you spiral, you go to the worst possible scenario. So for a person who is sick or for a person who is taking care of a sick person, it's good not to isolate yourself. Stay around people, interact, do what you used to do for fun. Don't see it as the end of your life, so much so that when you find your diagnosis, it's like that is the end of your life. And when you start taking care of that person as a caregiver, it should also not be that your life is centered around taking care of this person that you forget yourself, because you forget yourself and then you find that you can't help this person. And another thing is to stay positive. I know it's hard, but it's one of the most important things that we can do. Look at the good. It can't always be about the bad. You can look at the good parts of your life, your friends, your children, if you have them, your spouse, your parents, just the positive things in life, the things you've done that make you proud of yourself. Then another thing is to what do I say? Get physically active. Don't just sit around. Sitting around will not help in any way, either health-wise or by helping your mental states. Walk around, run, go to the park, whatever makes you walk around, move. Just as long as you're not in bed from morning to evening, then the next day the same thing again. And then the last thing that I can say is to try to develop some coping skills. Uh, we are different, we cope differently. Someone might cope by, immersing themselves into work. Another one might cope by going on long holidays. So whichever coping mechanism helps you as the patient and as the caregiver, adapt that and stick to it. It might and it will help in the long run.
Okay, wow. Yeah, I was taking notes as you were explaining, and I was like, okay, you've mentioned like how do we get, how do I isolate myself, especially now with COVID, and
Mhm.
which has become, a little bit difficult for people to integrate.
Mhm.
And I'm just wondering, apart from the things you mentioned, like keeping in touch with people, are there other things that someone can do even within their own space that can
Mhm.
probably make their mind occupied, take them away from thinking about negative things? Yeah.
Yes, there is actually. we know since last year, or actually 2019 December, it's been hard because of COVID, yes. But the good thing about life nowadays, we are not in the 1900s anymore. There's a lot of technology. Right now, we are speaking through Zoom. You're in another country, actually in another continent, but you're still speaking, you're still interacting. And then another way is music. I've actually found that music is a very good catalyst for good feelings. You know, you listen to uplifting, upbeat music depending on your mood. If you're sad and you're listening to sad music, you're going to start crying.
Yeah.
That's what happens. So, music, dance, art, just anything that makes you feel positive and
Mm,
that you have something that is distracting you from the negative thoughts that can permeate your mind, especially during that time of sickness. And as you know, cancer patients go through a lot, especially with chemo and the treatment, and it's hard on their bodies.
yeah.
So just do what makes you happy. That's what I'd say. It will depend on different people, but just do what makes you happy.
Mm,
Yeah.
okay. Yeah, thank you so much for talking about that. You also mentioned about seeking professional help.
Mhm.
Um, and what would you tell someone who has no capacity to seek for professional help? Are there any other alternative support systems where they can get that help from?
Yes, of course. I know that it's hard with especially with financial situations, because you have to think about one thing and maybe you don't have money for the other. But there's peer counselors, your friends. Maybe if you don't want to put that burden on them, for us, there's religious leaders. Depending on whichever religion you are, this person may help guide you in your journey. And then there's also pro bono services from the mental health workers. There's people who offer pro bono services. So if someone can be able to look for anyone who's going to help them pro bono, then that is also a good way.
Yeah, that's quite interesting. The thing is, I think it's also very difficult sometimes to get someone, a counselor on a pro bono, especially
Yeah.
because how do you talk about your issues so that you can get a pro bono counselor? That's already a problem, because most of the times I think people suffer because they don't want to share. And sharing is, like the way we say, a problem shared is half solved, kind of a thing. So I think maybe people need to also learn how to open up and not pile up with a lot of issues and challenges by themselves, and
Yes.
make their circle close of support, to make sure that they can always touch base with their friends. So I think that is something that we should take home from this conversation. So,
And
and then are there any negative coping strategies that people should be aware of and they should not do?
yes, there is. There's one thing, especially in this age, and I'm going to talk about Kenya and the entertainment scene, especially for the youth. They will use drugs as a coping mechanism. And when you're sick, obviously these drugs are going to affect the full potential of the drug that you're being given. So one of the most negative is engaging in risky behavior, using drugs, maybe engaging in unprotected sex, because it can bring also other problems with it. Um, Also, I think another thing is just being with people who don't bring you up, and they're always bringing you down. And there are such people, and we know there are such friends. People, someone will never be there for you. Just when you're feeling down, they're like, "Oh, let's go get a drink." That is not healthy. you're not in a place to enjoy yourself in such a way, you need to take care of yourself then and
Yeah.
not engage in risky behavior.
Yeah, that is quite interesting because I think a lot of people also they also feel like, oh, if I'm stressed, I'll just take one for the road and I'll be fine,
Mhm.
or
Yeah.
I'll just sleep over it, I am strong. In my
Hmm.
family, we don't cry, where I come
Yeah.
from. Yeah, where we
Yeah.
come from, we are tough. We are still.
Yeah.
Yes,
Yeah.
that is good. I hope someone watching this will also take that, and also to emphasize the need for self-care. Really, like it is so important to ensure that you take care of your well-being, and your mental health is so important. Your physical
Yeah.
health is so important. Having peace of mind is so important because um one thing affects the other. And as we know, our bodies are so much linked to everything that happens around it. So that is important for everyone to take good note of that. So
Mhm.
you mentioned you're a mental health advocate. Could you tell us what you do when you're not working?
So when I'm not working, as you know, we have an organization called the Gold Ribbon Initiative, where we work with kids who've been affected by cancer. And it's an initiative that you and I, of course, started in 2014, and it's still standing till today. So when I'm not officially working as a social worker, I visit those kids, talk to them, sing with them, play with them, and such things to lift up their mood and make them feel that they're loved and that they're cared for. And I also get time to talk to the parents because, especially for them, I think it's a hard burden to see your child in such a state.
Yeah.
Yeah.
Could you tell us, like, as a mental health expert or professional, why is it important to do what you're doing, like visiting the children and their parents?
It's really important because, especially for these children, when you see them, most do not understand what's happening. And we all know explaining hard topics to a child is something that has never been easy. So, my main reason for visiting them is to show them that someone is there, that I care, that I need them to know that someone is always going to be by their side, no matter what, no matter what they are going through, no matter what their parents are feeling. I am there to talk to them, help them in any capacity that I can.
Yeah, yeah, it feels so good when they know that someone else is caring and that they're not alone. And also, that feeling of being excluded from the outside
Yeah.
world is so hard, and it's kind of difficult. So I also think, like, the fact that they can be able to see people from different um, professions, backgrounds, and they can be able to kind of have their small world around them and connect. Somehow they connect with the world outside. That is very important. That is so good. So that is good work. Continue doing that. And anyone who would like to join, they can. You can drop your comment on the section comment below, or you can even drop an email on the email address on the channel. So, Mary, I don't know what other, like, final words you'd like to share with our audience.
Yes, we have to know that already life is hard. And for those living with cancer, it's even harder. So, whatever I and you can do to help this person, to make it easier for them, to make it better for them, let's do it. let's not bring them down.
Mm,
If you can visit, right now it's hard because of COVID,
mm,
but if you can visit, share an encouraging word with that parent or child or anyone who is sick or anyone who is taking care of a sick patient. Just be a positive effect in their life. Be a candle. Don't be that person who's always bringing them down, because they're really going through something that maybe you and I cannot imagine. So
yeah.
let's help where we can. Let's be there for each other. Let's be our brothers and sisters keeper.
Yeah,
Yeah.
thank you so much. And just to add on to what you're saying, it's so important for everyone watching to know that it is so important to support the people who really need us the most. And you can always call the Kenyatta Hospital. They have a direct line for their corporate affairs. You can call them. You can ask them whether they have any protocols for current visitations to them. If not, you can ask them how you can be able to help them, because I think they really need you and I and everyone else. So feel free to do that. You can also, and I think Kenyatta have a very good network now on social media. You can
Yes,
reach them
yes,
on
yes.
Facebook, on Twitter, I think. So feel free, call them, find out how all the kids are doing, and yeah, see where you can be able to help.
Yeah.
Yeah, so thank you so much. This was amazing. Continue doing a very good job. I'm also one of the advocates, and yes, let's support our children so that they can be able to fight this battle with a lot of hope, with a lot of encouragement, and they feel like we have not felt them as the generation that went before them. So we need to be, it's our responsibility to make sure that their life is a little bit better. So
Yeah.
thank you so much, Mary. And to our
Thank you.
audience, I want to remind you, continue subscribing, leave a comment. If you'd like us to talk about another topic, please let me know, and we'll do that. We'll make sure that we listen to you and we adopt to the content that you'd like to listen to. Thank you.